Hi everyone, I'm Gloria, and I'm going to talk to you all today about my research on the ethics of dementia. I split my presentation into four sections. The introduction, where I'll basically give an overview of why I initiated this research and why I think it's important. And the discussion will basically just discuss my findings of Alzheimer's and its associated pharmacological treatments and the ethics of prescribing patients with or without capacity and the decision-making process that comes with it. And the analysis will bring together all the information I gathered and give my own opinions and evaluate the burdens of pharmacological intervention. And lastly, I'll just conclude my research and summarize my findings in the conclusion. For the introduction, I wanted to find out about the ethics of dementia, and I consider it a really important research topic for myself as I personally have family members suffering from this common disease. And through it, I hope that the decision-making process for prescribing drugs with a lot of adverse reactions will become more transparent for other patients and their families. So I thought the best way to answer it would be reviewing primary literature reviews, as I don't have access to that research and can't conduct my own experimentation. So I focused my research evaluating the risks, burdens, and the benefits of pharmacological intervention of dementia within basically the context of the British National Health Service, so the NHS in England. Yeah. So for the discussion, let me first introduce you to the idea of dementia. So it is defined as the decline of mental ability severe enough to interfere with daily life, including the decline in memory, reasoning, and thinking skills. So Alzheimer's is a type of dementia, and it accounts for around 60 to 80% of dementia cases and affects an estimated 850,000 people in the UK. So it is very common, and it's not a normal part of aging. It can cause symptoms in memory loss and problems that really do interfere with daily life. And so it is a disease for all, aimed at old people, and is most usual for people over the age of 65. And I think it affects more women than men. So currently it is a progressive condition with no cure, and however there are medications to relieve and slow down the progression of the disease. So it is a focus for future research, as because of the aging population, the condition is getting more and more relevant. So there are three main types of pharmacological intervention treatments targeted to the disease. So first off, it's galectamine with the brand name Ramnol. So it is an acetylcholinesterase inhibitor, which basically works by breaking down the substance of acetylcholine in the brain, and it is a chemical that helps nerve cells communicate with each other. So the treatment is basically targeted with patients with symptoms of mild and moderate Alzheimer's disease. It's proven efficiency in improving cognitive behavior, appetite, and activities of daily living, global functioning. However, the adverse reactions are also quite mild, including nausea and loss of appetite, and occur in only 20% of patients taking medication. So that is quite rare. And in comparison to other treatments, it has quite a quick recovery time, as patients usually get better 2 weeks after taking the medication. So next up is Mementine. So it is another treatment, but this is also targeted at patients with moderate to severe Alzheimer's disease. So it is suitable for people who cannot take galectamine. So it works by decreasing abnormal activity in the brain by blocking the effects of an excessive amount of chemical in the brain called glutamate, involved in brain function, such as learning and memory. So it basically helps the ability to think and remember, and may slow the abilities, slow the loss of the abilities in patients with the disease. However, it also cannot cure Alzheimer's, and it can or prevent the loss of these like abilities in the future, and symptoms will also get worse with the medication. So adverse reactions are more temporary and include like headaches, dizziness, and constipation. So this is the most recent drug. It's called the lecanemab, and it's still in its like phase 3 clinical trial. So it is an amyloid beta directed antibody that targets amyloid, which builds in the brain of people with Alzheimer's. So it is more so for patients with a mild cognitive impairment or mild dementia associated with Alzheimer's. So it is currently the most successful drug and is proven to slow the rate of disease progression by 20 to 30% after 18 months of treatment in patients with like early symptoms. So the most common adverse reaction is infusion related reactions, so including like flushing, chills, fever, rashes, and body aches. So it is another adverse reaction is amyloid relating imaging abnormalities with edema or fluid formation in the brain. So the adverse reactions may be more serious in comparison to like other treatments. So studies with lecanemab also have shown substantially lower rates of adverse reactions than other drugs, but since it's such a new drug in the market, not as much research has been done on it yet. So there are obviously different ethics surrounding prescribing patients with and without capacity. So capacity is defined as the ability of an individual to make an informed decision free of coercion. So it emphasizes on the respect of patients' autonomy as the central premise of the concepts of informed consent and shared decision making. So it also supports patients in their decision making process to give consent or refuse medical intervention based on their values and information provided by clinicians. So a patient is basically free to give, have like patients assumed to have capacity is free or to give or withhold consent. So a very important point is that the ethics of prescribing patients without capacity should adhere to the Mental Capacity Act, which is established in 2005, which allows patients to without capacity to use an advance directive, which means that they can basically enable an individual to influence their course of their care at some point in the future. So this is done when they had capacity, so they can use this method to plan for the future. And this basically becomes effective when the patient loses capacity, so they basically are able to control their care for as long as possible. However, this does not confer the power to give or withhold consent, but it does confer the right for the donee to be consulted. So an individual can refuse all life-saving treatment, but it is important that they do not have the right basically to demand for the right to die. So clinicians registered with the General Medical Council, which is a council in the UK, basically have to adhere to the ethical standards to make sure that decisions made are the patient's best interest, especially because it is very important for like a disease like dementia and Alzheimer's. So the GMC's 7 principles of decision making and consent help doctors meet the standard of ethical principles that underpin good practices. It emphasizes that all patients have to be involved in their decision and their treatment to make as informed decisions as they can. So the exchange of information between doctors and patients is also essential for a good decision making. So the benefits of a treatment may prolong life, improve a patient's condition, or manage the symptoms must be weighed against like the burdens and the risks for that patient. As we know, a lot of pharmacological drugs have their adverse reactions, so it's difficult to determine if it is right to be used for a patient. So this is basically a 10-point pathway for the best interests of decision making. So I'll quickly go through it. So it's firstly establish what is known for the patient with consulting and to see if any important information is missing, and then also considering ethical and legal considerations that arise with regard to clinical decisions, and also consulting with family members or carers to establish a broad agreements on next steps. And to also, a very important thing is to basically make sure that no assumptions are being made, especially nothing about age, appearance, or race that can be discriminatory, and to make sure that all parties communicate with each other properly on a regular basis. So also identifying the risks, benefits, and burdens associated with the proposed course of action, check that alternate courses of action could be applicable for the case, and consult guidelines and seek legal advice before proceeding, and try to ensure that current known patient wishes are being respected. And once a decision has been made, make full notes on it. So this, you can see that the process of decision making is quite elaborate and needs to be very important to make sure that it is in the best interest for the patient. So I'll go into my analysis. So I'll bring all the information together and evaluate the burdens of pharmacological interventions. So pharmacological interventions are designed to help delay the functional decline, but do not alter the course of the disease. So adverse drug reactions are very common and usually occur to up to 90% of patients with AD and have a substantial impact on both patients and caregivers, as this is like a very long journey, and it can also be like, it can cause a lot of distress on all parties involved in it. So it is argued to be unethical to treat AD patients with a medication due to their highest modest efficiency, cost, and usually very little improvement in the quality of life. So we will go into burdens for each treatment. So galactomine is a duocholinergic treatment that improves cognitive behavior and delays symptoms for caregivers and symptoms and caregiver stress. So it is basically the most widely prescribed drug and has the most highest rates of treatment discontinuation and side effects. So it was also reported that around 46% of galactomine treated patients have gastrointestinal adverse reactions, and it is also extremely costly, of around like $12,000 annually for a patient, which is a lot of money for like a normal family. And however, in comparison to other treatments, its effects are usually more clinically relevant, and it shows around 2/3 of patients who receive the medication are judged to have improved or remained stable for 6 months. However, its side effects are also less severe, with only 92% of adverse reactions being mild to moderate and only like 12% being serious. Therefore, it's relatively like more successful in slowing down the progression and also decreases the patient's need for care. However, it's not completely effective, as the quality of life will still decline. And so scientists are currently looking for like better treatments to replace it. So memantine is also like another pharmacological treatment for AD, and it shows small improvement on cognitive function, as like no significant differences were observed by the addition of the treatment. So its open label phase, which compares and gathers additional information, also shows that no effect on the underlying progression of the disease, and often the rate of the change in patients over time until shows the rate of change in patients with moderate to severe AD accelerates over time, and until like a stage of very severe disease is reached. And it was also very expensive, costing around $1,800. So, but however, it shows the best profile of acceptability, but comes with serious risks if it is not taken as prescribed. So this can be argued that the risks outweigh the benefits, as it is also can lead to a very quick deterioration of the quality of life, and a significant burden on patients and their families, and a considerable cost as well of the drug. So lastly, lecanemab is deemed the most successful of the three drugs and is currently in research and most likely to lead to a clinical, like slowing of the clinical decline in AD. So its phase 3 clinical research has reported that the rate of cognitive decline involving patients have slowed the rate of like 27% of patients, which is quite a substantial and outstanding result. And it has also lowered rates of adverse reactions with 21 of patients who received lecanemab having incidents of adverse reactions. However, it has the most severe as it can lead to very serious conditions of blood vessel leaking and also localized spring swelling and bleeding in the brain. It is currently the only drug that is not approved by the NICE, which is a institution in the UK. So patients who only enroll in the clinical trial will receive it, and the costs are not covered by the NHS. So, and it is extremely expensive, around like $26,000 per year in the US for just the treatment alone. And the cost, however, it is important to remember that the cost for these medication only accounts for 5% of the total cost of care for Alzheimer patients. So all patients in the UK have the right to choose to use pharmacological treatments that would increase caregiver stress and time in the nursing home placement. So in the UK, NHS covers the cost of both galactamine and memantine treatment with tax payments. However, it doesn't cover the social care costs, which is very important. So the cost of dementia is currently £34 billion a year, which works out as an annual average cost of like £100,000 per person with dementia, which is like obviously a fortune. So 2/3 of the cost is paid by people with dementia and their families by usually selling the homes of patient, either in uncare, paid care, or in paying for private social care. So to conclude, um, through my research, I've discovered three main dementia treatments, which are galactamine, memantine, and lecanemab. So the ethics of decision making ensure that it is the best interest of the patients, and patients with capacity have the right of decision making and refusing treatments. Whereas like patients without capacity can use advanced directives to basically influence the course of treatment for as long as possible when they lose capacity. So I thought this was very interesting for me because I was able to understand and like better experience the harrowing decision-making process that patients and their families have to go through. And pharmacological interventions are very expensive and may not even be effective, as it can always lead to symptoms getting worse with like lots of adverse reactions. However, without the use of treatment, the condition will continue to deteriorate and will also lead to a nursing home, which also costs a fortune, basically. So thank you so much for listening to my presentation.